Excellent. Well, I don't want to delay too long. I know we're going to have some more folks rolling in as we get past noon Pacific. But just want to kick off and say, Pear is so excited to have the folks at Vituity here with us today. We are so passionate about helping all startups, and especially startups in the healthcare space, and especially very, very relevant these days as we're fighting, a healthcare crisis and COVID. And really excited to hear from the Vituity team on how startups can really actually successfully disrupt the healthcare industry and work with physicians. So that's why we're psyched to have them all here today. And I don't want to delay this too long, so we'll get right to them. But just quickly from me, hi, I'm Kirsten Byron. I'm VP of Ops here at Pear VC. But really what that means is I get to work with wonderful folks in different industries, to come speak with us, to partner with us on investments. So really excited when I got to meet the Vituity team. You'll be meeting in a moment. And in case you don't know Vituity, they're a physician-owned healthcare delivery organization. They're based in California, but have expanded much beyond that. And I'll let Lindsay talk a little bit more about that. But welcome to Lindsay Kriger, who's Director of Transformation and Business Operations. I'm going to hand it over to her to just talk a little bit about her colleagues, as well as a little bit more about Vituity, and actually just jump straight into our topics today. A quick logistics note for you all. So please put your questions in the Q&A function in Zoom. We'll be answering them all at the end as much as we can. So as you have them, please feel free to put them in there, even if it's earlier in the talk. And then we'll have 3 sections where we get to hear from Lindsay, as well as Andrew and Bobbie, who are here today. And then we'll be leaving plenty of time for questions as well. So thanks so much for joining us. And thank you, Lindsay.
Awesome. Thank you so much. Welcome and thanks for joining us. Perfect. So you'll hear from Andrew later, who's our Chief Operations and Innovation Officer, and Bobbie Kumar, Dr. Bobbie Kumar, who's a family physician. We're really excited to be here and represent the team. So a little bit more about Vituity just before we get going. Vituity is the country's largest physician-owned partnership. It started 40 years ago in a garage. A few docs just wanted to find a better way to do medicine. And today it's a $1.25 billion organization. Physicians practice in 20 states. There are over 2,000 physician owners. There are 1,500 advanced providers. So these are nurse practitioners and physician's assistants that are always on the front lines of healthcare delivery, and 2,000 scribes. One day we might see scribes be doing some other things, but right now they are crucial in helping do documentation work for all of our practitioners. And then there's over 1,000 of us business professionals that help run the machine. So we do everything from revenue cycle management to on-site consulting, recruiting, IT, everything that needs to make the business of medicine run. It's pretty complex, and we're here to do that. So again, Vituity's grown over the decades. It's really mission focused, and its leadership is always really centered around patients and providers. One of the things I love most about how we continue to innovate is because of our leaders. So actually in 2017, we have a new CEO, Dr. Mu Tomlinson. He's really passionate about healthcare, but also about sports and about winning. And, Dr. Tomlinson is focused on making sure that all people, regardless of their background, get the coaching and mentorship and really the systematic support to make a difference in this world. So we just launched the Vituity Cares Foundation, and it's really an exceptional part of who we are as an organization. Check out that if you have some interest. So this is my adorable family. I'm lucky enough to have a wonderful husband. He's actually a final year resident. What a journey. And then our little son is just turning 2 years old. But before they all came into my life, I started my career in health. Really, as a teenager, I served on various social justice committees and held different leadership positions in school. And one of the capstone projects for me was around food insecurity and the inequity in access to food in this country. Living a healthy, thriving life really depends on access to food, and so many people don't have that. Although it seems obvious to many of us, health and health technology often assumes that individuals have these basic needs and they have enough health literacy to navigate a really complex environment, and that just isn't always true. So this passion really, continued as I went to college and graduate school. I have a degree in public health and studied theory and strategy, and really understanding how we can address systemic barriers to behavior change. So I take one of the simplest examples that we have, does everyone floss their teeth every day? Right? That's a basic health behavior that you're taught. You know you're supposed to do it, but honestly, I can guarantee most of you don't, right? It's hard to change behavior, and that's what a lot of health really is about. So I launched my career at San Francisco General Hospital, way over in this super old building that's off to the left in this picture. The Zuckerberg San Francisco General Hospital wasn't even built then. It is beautiful now, but this is a public health institution that serves all people in San Francisco. And I started my career on a National Institute of Health funded grant looking at the digital divide and how do we bridge the digital divide. So, 12 years ago, that meant understanding if technology would be available to make an impact on low socioeconomic and marginalized communities that might not otherwise have access. So I sat down with patients every day and I signed them up for their very first email address, because all back-end systems need a unique identifier. I taught them how to log into a patient portal and read lab values. We pushed text messages to patients for appointment reminders and medication reminders, and if there was new information from their doctor to read. And ultimately, the success was variable, but we proved that health information via technology can change behavior and therefore does improve health outcomes. So good news for all of us in the health tech world today, right? So we talk about the healthcare ecosystem. What does that really mean? Healthcare is such a ubiquitous term, but really it's the fastest growing area of business in the world. There's so many different areas you can focus on: clinical care delivery, patient access and experience, pharmaceuticals, biotech, public and private insurance, government programs, et cetera, et cetera. But one of the things that COVID-19 has really taught us is that this is a complex and very rigid system of delivery, and it needs disruption, right? That's where we all come in. It takes really big dreams to fix really big problems, and the good news for all of us is that there is both a human reward to doing this work and also a financial reward. The US spends $6.3 trillion a year. It's close to 18% of the GDP on healthcare. It's the country in the world spends the most. It's over $10,000 per capita, twice of what any other industrialized country spends. A lot of it's on expensive procedures and treatments. It drives up the costs like crazy. But there's also big revenue potential. So last year, the estimated annual revenue from patient care was over $1 trillion just in the US. It's really been studied and proven that the internet and health technology can make an impact and can drive clinical efficiencies. So if, there is a belief and there is a study and scientific data to show that people believe in health technology, and 65% of physicians believe that it can reduce the burden. So people are ready for change and they're adaptable to change. We just have to create the right change. One other important note for those of you that might not be in healthcare is that healthcare is really fragmented. There's a lot of small players in this big market. So even the top 10 competitors in the healthcare market only make up 7.2% of the total market. So we've got to get collaborating, we've got to partner with each other and many, many people to really make a change to get into this space. So my people, I love this picture. We all come to public health with this passion, this idea that we can create change and help create a better life. No matter your politics, your age, your race, your gender, your location, the emergency room is still a place in America that will take care of you no matter what. And we really believe that is a powerful place to innovate. So it's our favorite breeding ground because it's for all people. I actually have one of the, a privilege of being a founding member of this team. I have a lot of great mentors that have helped me get to where I am. And we've launched projects big and small. We've built new lines of business for the organization. We've expanded access to care via telemedicine to hundreds of thousands of patients. It's a tenacious group of people, it's a passionate group of people, and we all really do live the motto that you can impact one patient and one provider at a time. It's my friends, it's my mentors, and of course it's all of our doctors. So this is both a group of physicians and non-physicians, but you can ask Bobbie when anything is wrong with my child. She is the first person to get a text message from me, including the lice episode of 2019. That was horrific. But I just want to leave you guys with the idea that innovation and making innovation and healthcare innovation reality is to remember that it's local. We need to just talk to real people from diverse backgrounds, geographies, cultures, clinical care settings, build companies from passion, from personal experience, and that will ultimately create the healthcare that we all want. So with that, I'm going to hand it over to Andrew to go into depth, and we look forward to working and partnering with all of you soon.
Thanks so much, Lindsay. That picture is awesome because that's my wife and my son right in the front, and it's a great memory. He's grown up so fast, so it brings back great memories. I'm going to talk through a couple things. Number one, healthcare is broken, and I think we all know that. Equal access to high quality care is not available in the country or the world, and that is really close to our hearts. Everyone deserves the highest quality of healthcare possible. That's why Vituity exists. It's why we started the foundation. It's why our team exists. Everyone we work with really has a heart for taking care of people. And access is not there. Like Lindsay brought up, this is a $6 trillion expense, and we can't figure it out. And over the years, you can see some improvements, but not enough. And that's actually why I'm most excited about being in this talk and working with Pear and so many entrepreneurs and startups. Vituity knows we can't do it on our own. Health insurance companies can't do it on our own. Provider groups, hospitals, health systems, we actually have to come together as a culture and community to solve these problems. We see them, the most out of the box thinking does not come from inside of healthcare. And that's why it's so important to find founders and startups that are really passionate about solving a problem, thinking about it creatively through data, through science, through just out of the box creativity to really help us figure out how to solve our problems, how to improve access to care, how to improve the quality interaction between a provider and a patient. I believe that the future is technology being the primary interface between a patient and the provider. And that's incredibly important and increases access everywhere you go. The problem is you still have to have that personal connection. You have to have the understanding of the patient. The patient needs to feel comfortable with the provider. And so many of the interesting startups that are coming out right now are founded on the idea of engaging the patient and the physician and provider together. And that's so important and so exciting, and why we like working with other companies. We're not always great at thinking outside of the box or using the most recent technology or data to actually improve care. And so we're so grateful to be here and meet so many of you. So this is my whole life in one picture. I had a beard then, I don't right now. Maybe I'll grow it back one day, but this is my wife and my son, and they're everything to me. And healthcare has actually impacted my life and all of us in such a personal way from the beginning, the day we're born till the day we die. And sharing our personal stories are incredibly important to me and our team. And every time I meet a startup and they're trying to solve a problem that impacted their family, I'm always incredibly inspired by that, or a friend or our parents or our grandparents. So my family grew up in a not very affluent part of Brooklyn, New York. And my father suffered from significant mental health illness, but didn't really talk about it or have access to any care or really knew that it was okay to talk to anyone about this. And eventually, mixed with substance abuse and not having anyone to help treat him, he committed suicide when I was 7 years old. And my mom and I immediately moved into my grandparents' house. My mom was like, okay, I have to figure out life for my family. And at the time, I didn't really understand what all this meant. Of course, I was 7. And my mom became a phlebotomist, went to nursing school. I never saw her for quite some time, but I grew up with 2 awesome moms, my grandmother too. But she really started to talk to me about the way healthcare is delivered. I watched her walk to the phlebotomy office, to the hospital. And I started to understand that in our neighborhood, like, everyone didn't have access to care that they needed. My dad had no one to talk to. And I started working at a hospital when I was 16, and I just wanted to solve problems and help any way I could. And that really kind of founded my passion for mental health, even though at the time I didn't really understand it, access to care. And then also, my mom and I never really even talked about this that much, which is not healthy. So fast forward a number of decades, and my grandfather, who I was close to growing up because I lived with my grandparents, started to get chronically ill. And so I started to see another side of what lack of access to care and organization means. He got very sick. He had multiple comorbidities. And eventually he had to go on to hospice. But I watched my mom and grandmother try to figure out healthcare for him, which was insanely difficult. And my mom is a master's prepared nurse, and my grandmother is a sprightly 85-year-old woman who would drive him to 15 doctor's appointments, pick up medications, do all of the work for him. And they still were calling me all the time and our whole family to help try to solve these problems. There's this one specific story that really struck me. At some point, he came home with an oxygen machine, and he needed it full time. So it was plugged into the wall for 30 days straight. And my mom got something like a $800 electricity bill. And she called me and she said, is this right? Do I have to pay this? What does it look like? And I said, well, give me 15 minutes and I'll call you back. And I found out that there's a voucher for that if you need it, and that would pay for your insurance bill. So we got that worked out. And I thought, man, how many people are getting this bill? And then I kind of just moved on with life because we figured out this problem for my family. And I read a newspaper article like 2 months later about a woman in the Midwest who went home in the same situation as my grandfather, but didn't have anyone checking on anything. She got 2 or 3 $800 electricity bills, and they turned her power off and she died. And I was so upset about that because it was a completely unnecessary death that a few phone calls could have fixed. All of this together, when my grandfather went from, seeing 20 doctors a day to going on hospice and being able to call one person all day to get all those solutions, it made me just realize, like, through my entire life, how broken our system is, but also how great of an opportunity there is to help solve the problems. And when I see startups working on behavioral health, mental health, being able to talk to people at any point, leveraging technology to make sure those bills always get paid for, and using all of the data and tech that we have to help solve those problems so our physicians can focus on taking care of people, that's incredibly inspiring. It what drives me, our team, to go out and solve these problems. It's a $6 trillion problem, and we can go fix this. So a lot of people ask, what happened in 2020 to healthcare? And it is such an interesting phenomenon because I worked on projects from sending doctors to New York City to figuring out how to save as much money as possible, figuring out how to get patients back into the hospital that didn't have COVID, that were homesick. And so it's been such an incredible roller coaster for healthcare. And I could not have predicted any single piece of this accurately, but I do have some observations from it. Number one, COVID is obviously scary, but we can figure out how to take care of it and help our country. But that doesn't mean that everyone in this country actually has access to the best care they have to treat it. And when we went to New York, that was really one of the major issues we found, was there were many communities that were not getting the care that they deserved. And there was a lot of preventable death there. Number two, there are many sick people in this country that weren't coming to the hospital or asking anyone for help. We have some physicians that were actually doing like home checks on people that they knew were there, but didn't know how they were doing anymore. And so taking care of people at home or in their grandparents' house or at a SNF or anywhere they were, reaching out to them has become incredibly important because we don't know where everyone is that's sick because they're scared to go to the hospital. And also health tech got launched into like 5 more atmospheres through this time. We went from seeing maybe in the hundreds of thousands of patients on video to the millions. There are so many patients on video. It is incredible. And learning how to take care of them effectively, leveraging technology and data to do it right is so important. So 2020 in some ways sped up a lot of solutions, but in other ways uncovered so many issues that we have to go back and fix. And I hope that there's a lot of amazing ideas and companies coming out of this, but taking care of people and healthcare at home is our future. So we get the chance to meet with a lot of startups, and I think that I have a couple points of opportunity that I really think is important to our future, and also a few recommendations as you navigate healthcare. Number one, we believe everything right now is meeting where our patients are at. And number two, leveraging technology to make the physician and provider relationship with the patient stronger, not to get in the way of it, but to augment everything that is a waste for the patient and provider to do, to actually spend quality time together so treatment can be engaged and delivered. So some of my recommendations, because we see a lot of pitches, and healthcare is an interesting market in that it's incredibly complex, slow to innovate, and expensive. So number one is fully understanding the problem you're going to solve. And through all of our life experiences, and the picture Lindsay had up of sort of the it's complex, and really focusing in on one area and keeping it simple is so important. If you try to solve all of the problems of healthcare in one swoop, it is going to be extremely difficult. Number two, you really need patient and provider feedback. With whatever you're rolling out, you need to hear from patients and providers, and not just in one location. One location is a great place to start, but one of my recommendations is having a diverse set of pilots. San Francisco is not Southern Chicago, is not Texas, is not Nevada, is not New York. And healthcare is incredibly local, and Lindsay mentioned that a little bit, but understanding your patient population, your providers, and the culture of healthcare there is incredibly important. A final couple words are, you need a sound financial model. There is a lot of money spent in healthcare, but to come forward and say, there's an opportunity here, this is what it looks like, here's how we're going to save and generate revenue, is incredibly important. I think it has to be more detailed earlier on than it often is. And then when you're scaling, you have to scale thoughtfully. Sometimes people come to us and ask for us to, I want to do this at John Muir Hospital tomorrow with private pay insurance only. And that might be okay for a very small sample of things, but that's not how healthcare is delivered. The emergency department is the front door of healthcare. We're going to take care of everyone equally, always. And we want to build solutions and products that work for the entire community in this country. So I'm going to turn it over to Bobbie, but I just appreciate the time and the opportunity to partner with people. We want to help solve these problems, and we think that all of you are going to be a part of that. So thank you.
Thanks, Andrew. So thanks everyone for the opportunity to speak today. This is my adorable family. This is actually one of the few professional photo shoots I've taken, and unfortunately, out of the 20 photos that we took, this is the only picture that we have hanging in our house because my son had just woken up from a nap and refused to put down 2 toy trucks in every single photo. So thankfully, my husband and I were laughing during this process because the trucks are in every picture except for this. My husband is holding his hand very tightly to hide one of them. But this is the only family photo we have hanging, and I always think back to these annoying trucks that just happen to make their way into our family photo forever. But, as Lindsay had mentioned and Andrew had mentioned, I'm a physician, I'm a family physician, and this is a picture of my first day at residency, so baby doc days. We were, on the very first day, they give you your new clean, crisp white coat. We don't have any pens, highlighters, reference pads in them. We're smiling, we're rested. If any of you have had any experience with physicians who've gone through residency, you're working 80 plus hours a week. Sometimes calls are 30 hours a day. So it's really hard, sometimes to think back to what your quote residency days were like, because sometimes it's just a blur. And in in a physician's career, you're always going to find that somewhere along the way, they'll come up with that one, the one patient that has stuck with them, the one whose diagnosis they'll never forget. It's the one whose face will kind of always pop up, especially if the clinical scenario is very reminiscent to that patient. But this is the patient that shapes you into the type of physician you want to be, establishes the type of physician that you are, and always drives you to be better. Typically, you'll come across your one later on in your career when you're a big doctor, when you're an attending and you've got to experience the real medical world. But mine actually occurred in just the first few months of residency. I'm a family medicine physician, and so one of the things we pride ourselves on is patient continuity and having that relationship with the patient. And so my one, we'll call her Mrs. L. I had met her just within the first few weeks of residency because her physician had just graduated. As an intern, you're lucky. You get 45 minutes with every patient because you get to perform the full patient encounter. You get to do a physical exam. You can research the patient's chart, do some research on the condition that you're managing, present your plan to an attending, review medications, lab tests, imaging. You have pretty much almost a full hour to come to a conclusion as to how to manage the patient. And in doing so with Mrs. L, I had noted that over the last 8 months, she had 5 separate visits with 3 different physicians. There's 20 residents that rotate through. And so if her primary care doctor wasn't available, then she would see the next resident. And in her chart review, I had picked out certain symptoms that she kept coming back for. And once again, she came back for the same symptoms. And we have something called red flags. These are the key symptoms that trigger us to say, we need to look into this a little bit further. And she noted weight loss, hoarseness, and she was a heavy smoker. And so I'm not going to say that as a baby doc, I knew exactly what she had. I didn't. I knew enough to say she needs to go see somebody to get this checked out. And lo and behold, she had one of the rarest cancers. It was stage 4 cancer of the uvula. Thankfully, she successfully got treated and lived on for a few more years. All of this to say, Mrs. L was that patient for me, not because, like I said, I knew what her diagnosis was, because I didn't, but because she affirmed something that I hadn't really experienced yet, and something that I now think of every time I see patients, that it isn't about the number or frequency of interactions that truly makes the difference. It's about how meaningful that interaction is. Which is why disruption with digital health right now is ever more so important. Meaningful interactions have become less and less of that primary focus. We're talking about electronic health records and digitizing, the types, how we deliver care. And a lot of the focus has been outside of this relationship. And this is critical because we have, only 220,000 practitioners who are practicing primary care in this country for a population of 325 million. As you can see, there's a substantial deficit. Over 3/4 of physicians sometimes, often or always, experience feelings of burnout, so much so that almost half of physicians are looking for career changes. They're looking to practice something outside of clinical medicine because the administrative burdens just continue to pile. So technology continues to evolve, but unfortunately, we are faced with the fact that there are some key changes that have to be done, because the ones who are now going to suffer if this continues are the 2 key players on the field, and that's the physician and the patient. So this is where I feel that technology can play a tremendous role. First, focus on the replaceable aspects of care. I'm sure if you're in the health tech space, you're seeing many pieces in the end-to-end process that are what we would describe as replaceable: clerical tasks, administrative tasks, delivering care to where the patient is and not necessarily where they're supposed to be, which may not necessarily be their home. Compassion, empathy, these are the pieces that can't be replaced. And so structuring technology and solutions to focus on the areas that can actually be disrupted and would actually have a place, I think is where the opportunity is. So when we're talking about technological solutions, create the unimaginable and don't accept the status quo. Just because something's been done doesn't mean it's been done the best way possible. It's just one facet of many sides that have been unexplored. Another example is productivity of physician. We talked about the deficit in primary care physicians in this country. How do we improve the productivity of the patient where they can see, or the physician, where they can see more patients without compromising that interaction? As I mentioned, as a intern, I had spent a lot of time on chart review and medical decision making, capturing those important events and milestones in a patient's history that apply to their care at the time that I'm seeing them. There's also, social aspects, emotional, environmental barriers to how they impact a patient's outcomes, and being able to quickly identify those, being able to factor those into our medical decision making, not just enhances the relationship that we have with the patient and understanding how we can improve the quality of care they're being given, but more importantly, we are now recognizing the things that we've been missing this entire time. What excites me about innovation, and I think you're going to find that artificial intelligence sometimes can have a bad stigma in the medical community amongst physicians, is that they think that it's going to, or it's been said that physicians are afraid that AI will replace us, and that is just entirely not true. More importantly, AI, I think, is going to allow us to have very timely and accurate decision making. As I mentioned, I was given 45 minutes as an intern, but in reality, as a primary care doctor, I am forced to see a patient within 15 minutes. My time slots are anywhere between 10 to 15 minutes to do the exact same work. So reducing that administrative burden that myself and the care team have to experience is going to be a very key and poignant feature in how solutions are able to penetrate the healthcare space. As I mentioned, we talked about the social determinants to health and how those impact health outcomes for patients. There are companies who are creating, digital front doors. I think the key here is to adopt solutions that increase personalization of the care being delivered. We want to retain the ability to recognize our patients, but most importantly for the patients to recognize us. Secondly, expanding access to quality care, not just nationally, but globally. Pathology that we see here in the US is vastly different than what we would see in places like India or Africa. So improving our physician knowledge, understanding of the conditions not present in our immediate geographic locality, I think gives us tremendous opportunity to just knowledge share. And my hope is one day where I can have a patient who has some obscure condition that needs to be evaluated, but the expert is somewhere in France, and I can do an immediate consult. I can get a treatment plan going. I can get all these things done from where the patient's at, and I can bring this to the patient as opposed to the patient coming to me. Flipping that dynamic, I think, is a great opportunity. So that leads into my top 2 recommendations as to how we can solve problems right now. First, disrupt the industry, not the mission. The top 2 reasons for choosing medicine is to either help people, and that is followed by intellectual pursuit, wanting to find something that's challenging enough for the knowledge base and the research. The physician-patient interaction is the foundation of clinical care and serves as the cornerstone for quality care delivery. So those that have gone into healthcare have chosen to do so at a great cost and sacrifice, even more evidence now by the pandemic, which is why really any type of healthcare disruption has to be led by those who are at the front lines. Inherently, physicians, we're innovators. We are nimbly adapting to the environment. Ask any ER doc, you don't know what's going to walk through the door, which is why physician leaders at your table will only bolster your success. So don't lose sight of our mission. That may mean that the path of least resistance is not necessarily the path that needs to be taken. But as you can see, with already staggering numbers of physicians leaving the field, there has to be a turning point. And then the last point I'll drive home is, we have to preserve the humanism here. The solutions that companies should come up with, they should preserve that human interaction. This is where patients and physicians connect. When you ask patients what they're looking for from their doctor, they're looking for honesty, transparency, communication, care, trust. These are things that you can't replicate with a technological solution, but you can make that process more efficient. You can secure it. You can deliver it to where the patient's at. And so that's, I think, the focus that we should be having when we're looking at disrupting the healthcare space. Because at the end of the day, that type of bond is what really helps with recognizing those red flags and avoids a near miss. And until we really start looking at healthcare as both patient-centric and provider and care team supported, we're just going to end up missing the target. So my hope for the future is that we disrupt the status quo and we model these solutions that not just promote, but really emphasize the value in the unique human experience. Thanks, everyone.
Thank you so much to all three of you for sharing your insights, but also just like a bit about yourselves personally. I love how you all just connect your own stories to your mission and a lot of the challenges in healthcare, but also a lot of what drives you. So thanks so much for that. We have some awesome questions, but if folks have more, please put them in the Q&A and we'll all try to answer them live if possible. So feel free to keep putting them there. But our first question is from Brian, who asks this is not an easy one, which facets of healthcare are in most need of change? So he cited a couple examples. Could it be lowering our absurd admin costs? Could it be facilitating value-based healthcare trials? So you may have differing opinions on it, but would love to hear your thoughts on what's in most need of change.
So I'll go first. I think it depends on who you ask. So I'm going to take it from the perspective of the physician. And even from the physician aspect, I just want to increase access at this point. There are so many patients, let's just take a step back. The pandemic has definitely highlighted the socioeconomic disparities in healthcare. It's highlighted socioeconomic disparities across the board in all aspects of society. So especially in healthcare, being able to leverage technology to deliver care to patients, we now have to think a little bit more concretely. The ER used to be the one space that patients who without homes, the homeless that would go for their care, for even their primary care. And now they're so afraid to go to the emergency room. So I think for me, it's how we can expand access to care and bring care to the patient, almost in a way of where we are, right now it's very patient driven. The patient seeks out the care. I would love to get to a point where the physician is the one that's seeking out the patient. And so that's my perspective.
From a kind of different angle, I'll add, and Andrew can round us out, that one thing that has to change in order to make Bobbie's dream a reality is the reimbursement and the financial incentive program has to change. So right now, physicians are incentivized and paid based on seeing patients that can pay for their services. And if we really want to create access for all, more equity, and more fairness in the system, we have to change the way fundamentally that fee-for-service medicine has been designed over the last 40 years.
Those are great answers. I would just say there's a couple things. Reducing costs, number one, because then healthcare can be distributed more equally across the country. The way it's so skewed right now, and everyone deserves that access. I said that earlier, but the idea that you could get a psychiatric assessment into a junior high anywhere in the country or at home or at a hospital has to be something that we figure out how to do at as low of a cost as possible. Also, insurance prices are incredibly high, and we have to move away from that model. I also, on the more geeky side, would say like the day that a doctor never has to touch a computer near a patient would be phenomenal, because the documentation burden on providers is so high now that it's not acceptable. And on the language and image side of it, so image annotation, so helping like AI actually help read images in healthcare will have a massive impact, and understanding language and being able to translate it, document, et cetera, will have a significant impact on provider productivity and patient experience.
Love it. Thank you all for that. And the next question is just around like, what are you seeing that's really exciting to you in 2020, whether it's innovation related to COVID-19 or elsewhere that you feel like is really transforming? You can name specific companies or just technologies that you find personally really exciting.
Andrew, you want to take that one? Go ahead. You know, I think that a simple answer is really actually just the energy around healthcare innovation. So I think the last year we've seen more young startups coming out for wanting to make a change in healthcare, whereas it was not such a, you know, cool topic a few years ago. So I think just the energy that people are putting into this field and the knowledge and the like quest to understand how things really work is something that I think really excites a lot of us, because the more people that are getting involved, the more smart brains, you know, like we said, outside of the people that are delivering care today are how we're really going to disrupt this. So we've been lucky enough to help partner with some of these young companies, and we hope to keep doing that because the energy is infectious, really.
Yeah, I would add, changing the way that care is delivered and access obviously is huge, but some companies that do that, recently we invested in June Motherhood, which is a pre and postpartum for moms, right? So my wife during COVID would definitely not go anywhere, but even before COVID was like, I'm going to go to my OB visit and that's it. But actually providing that level of care to a mom at home is really key. And we end up seeing a ton of moms in the hospital that don't exactly know how to access care. That could be done completely virtually at home, and that's the safest place. Sentinel Health, a remote patient monitoring company. So many people are trying to figure out like what devices work at home. How do we analyze that data? What do we do with it? It's incredibly important. You can't just put a blood pressure cuff on someone and say, I can take care of you forever at home, right? Like, it's really important to see that. I would say the companies that are really focusing in on images and language, like I said, I think are gonna come up with some amazing solutions. And one last thing I would bring up is in the behavioral health space, it is so broken and so difficult to get access to care that I just saw a company pitch to us that was wholly focused on middle school psychiatric assessments, therapy, making sure that a kid could ask at school, like, I need to talk to someone, and that immediately occur, and then not just be the nurse on campus. Things like that are extremely close to our heart. Outside of that, we would look at life sciences, Genie, a number of companies that are really trying to deliver pharmaceutical research in a different way at a much lower cost, changing the way insurance is structured. I think the companies that are kind of becoming the insurance provider really could disrupt the space, because they're getting in between the patient and provider, and they're almost becoming the new version of insurance. And I think that's very interesting.
The only thing I'm going to add is that from the physician perspective, I love how the patient is now in like a hub and spoke type of model. So you have this, you have the patient at the center, and you have everybody coming to the patient. So, you know, Andrew mentioned June Motherhood, like this is a community, a doula, other moms that are coming to, you know, giving the opportunity to come to the patient. A lot of our, you know, Sentinel is giving remote patient monitoring, bringing the testing devices to the patient so they can do this from home. And I think being more patient-centered in getting not only the right information, but the right wraparound support for the patient is what's most exciting.
Love that. I love that visual of like everyone can come to us now. So Rajiv kind of notes and then asks a question. So he was saying the hardest part of healthcare innovation is often finding clinical champions who are willing to pilot a new solution and also work for an org that has responsive IT. So how does Vituity think about fast tracking promising innovations to pilot them and then, you know, end up hopefully scaling some of them?
I'll take the first crack at this one. So for me, the reason I work at Vituity, I worked at a number of health systems before. The reason I work at Vituity is I believe you have to get the provider to buy in first. So either the doctor or the advanced provider, nurse, whoever it is, if they don't believe in it, it's probably not going to happen. And so I like taking pilots from the ground up instead of like corporate health system or payer saying, hey, we're going to roll out this new product, everyone's going to use it. That's not how to like relate to physicians. Like it doesn't really work. So usually the way we see it is we try to get as little data as possible, get a pilot going that's very small in one location with the solution and a provider. It doesn't matter what type, but whatever the solution is addressing, and start super small. A lot of startups will come out and say, well, I need access to your entire EHR and I need to do this, this, and this, and write all these APIs. And that's awesome. And that is the end goal. But like 9 months later, after an IT security check, right, then the hospital says, oh, cool, let's try this. And you're already so far beyond that. So we try to go so small with a very limited data set to build off of, make sure the providers buy into it, make sure we actually interview patients and providers, get good feedback, and then build the data sets, then get new connections and try to grow that way. The other thing is also important is once we get it going in one place, we need to get it into a different community that isn't structured the same, so it can work in multiple places, not just in San Francisco or Illinois or Texas. It's really important to get a few pilots that are small and getting the outcomes you want to see. You want to see those metrics come in because that's what's going to resonate to the hospital or the payer.
One other piece that I'll add to that, when we're talking about getting physician buy-in, I think the biggest question that a clinician provider wants to know is, how is this going to interrupt or disrupt my workflow? And so having a plan put in place for how to mitigate that impact, because as I mentioned, we're tasked with seeing patients so rapidly that we have designed a very good working operation that gets us the information we need in a timely fashion so we can spend the most time with the patient. And when new solutions are brought into the mix, there is always going to be a delay. And so having a solid plan for how to mitigate that impact, I think will essentially trigger more buy-in from the clinician.
Yeah, makes sense. And just a follow-up on that for you, Dr. Kumar, on what are some things you would maybe say to entrepreneurs about approaching physicians and like kind of doing that pitch? Is there any like general advice that you would have about what questions to ask or how to approach or how to put together a plan?
Yeah, good question. So I think from my perspective, when you're wanting to gain buy-in, when you're wanting to present a new solution, the key is to address two main things. Right now, we're sort of beholden to the payers. Every patient we see is going to be revenue. It's what keeps the doors open. So how that solution makes an impact on the patient, on the provider, and the bottom line. And having those three things dialed in, clearly delineated, really helps to drive the attention to the technology, because those are going to be the three main questions you're going to have to battle with any solution that's brought to the table.
Awesome. Thank you so much. Next question is kind of around kind of the implications of fragmentation that you mentioned earlier, Andrew, and just that affects, obviously pricing, access, interoperability, incentives, all these good things. What role do you feel like the government maybe has to play here, and could realistic like policy change actually impact some of the negative impacts, I guess, of fragmentation?
Yeah, so I'll go ahead and take that. The short answer is yes, they have a incredibly important role to play, and we all have an important role to play in partnering with them. So one of the programs that we've actually partnered with the Center for Medicaid and Medicare Services is called the Bundle Payment Program. They have a whole innovation center within CMS, and they're trying different payment models to see how we can bring people together. So how do we bring long-term, short-term care, the hospital, the care navigators, the primary care providers, how do we bring people together to lower cost? There's ACOs, you guys might know about that, accountable care organizations, and these are all programs that are led in partnership with government payer and with private payers. So it's really important to know that about 65% of the country has a private insurance, health insurance, but that means 35% of the country has a public insurance. And CMS traditionally is the leader in dictating reimbursement rates and what gets reimbursed. So if you're paying attention to the telemedicine space recently, that's been huge. For years and years, CMS has been conservative in how they let us use telemedicine for healthcare, and COVID happened and they said, you know what, we've got to help. We have got to let people see patients where they're at. And CMS opened up the opportunity for our providers to see patients and get reimbursed, and it's made a world of difference. So that's just one use case to show that they have a powerful role to play, but really it's going to be a collaboration between public and private that leads to systemic change.
Excellent. Anything you would add, Dr. Kumar or Andrew?
No, she nailed it.
Excellent. Yeah, the next question is just around kind of the types, I guess, of health tech, companies and innovations that you're seeing, like any particular areas you would mark potentially as maybe overcrowded. What are areas that are potentially more untapped that you think there are a lot of great opportunities to innovate?
I think EHRs are saturated. I think they've got that. So don't develop an EHR, please.
The other area that we historically saw a lot of is care coordination and all of the ultimate dreams of sharing medical records and sharing information. And like Andrew said, it only took, integrating these 17 systems and then we really can coordinate care. Like that market needs disruption in and of its own, I would say. Andrew's closest to that market, but that's another one where we really feel like the root of the problem was never really addressed, which was the patient's need in the coordination of those services.
Yeah, population health immediately came to mind. Like if you went to any healthcare tech conference in the last 10 years, all it was like pop health companies. And I truly didn't even know what most of them did. And so that to me, I like now, I feel like even during COVID, there's like a scrappier set of companies saying like, I'm solving this problem all in, I can connect with it, my family experienced this, boom. And I actually think that's so much better than this like overarching cloud of health data. Companies that want every piece of a human's data and want every piece of connecting EHR data, I think are really going to struggle unless you're like, everyone has Google or Amazon Fitbits on them and somehow like Big Brother takes over. I don't necessarily think that that's how it's going to happen. And engaging people in a real way where they are is the companies that get us excited. So just don't ask for all the data in the world. I think you'll be all right.
Excellent. Thank you all for sharing your perspectives. I'm just going to be selfish and ask the last question myself because I've been thinking about it. Dr. Kumar, you mentioned, physicians are a little sometimes skeptical of AI or have some feelings about it. Would you mind just expanding on what you hear and what your personal thoughts are?
Yeah. So, every time we think of artificial intelligence, you think of the immediate thought for somebody who's not in that space would be like, they're developing a robot that is going to be me and the patient is going to interact with the robot and we're going to be taken over. I'm being very hyperbolic, but at the core of it, there's this fear that somehow, some way AI is going to replace my ability to connect with people. And I think that there's a huge advantage for AI to take away some of the mundane tasks in the patient encounter. So, even just, getting the patient's history of their problem, that doesn't necessarily require me to sit here and talk to the patient to gather information. But making that connection, I think, is still really important. And I think getting physicians to understand how it's going to make the ability to connect with their patients, equally as strong, if not better, allow them to improve their productivity to reach more patients. These are the key pieces that really drive patients into this space. Like I said, I think physicians are inherently innovators. When you think of new treatment plans, like just in COVID, how many different treatment plans did you see come up? Because people are trying different things that's like in our nature to do. And so I don't think getting buy-in from a physician is really the issue. I think it's truly just understanding what the offering is and explaining how it's going to be impactful to the physician-patient relationship and continuing on the mission of just helping people.
Excellent. Well, thank you so much. On that, we'll wrap up. I usually like to wrap up about 5 minutes early, just make sure people get their beverage and on to their next meeting. But thank you, Bobbie. Thank you, Lindsay. Thank you, Andrew. It's been such a pleasure hearing from all of you today. We're going to continue doing speaker series events. If you've missed any of our past ones, definitely check out our Medium page. We've been doing great write-ups on all of our past speaker events, and we'll do the same with Vituity as well. But yeah, thank you all so much.
Thank you so much for having us.
Everyone. Bye.
This is awesome. Thank you.
Take care, everybody. Look to see you again next time.